All right, just a quick overview of our program today. I'm going to be introducing Aaron in a moment, and then after his presentation, we will do our legislative updates and then a few announcements. So I've known Aaron for a long time, dating back almost 20 years when he would sit on that side of the room representing Senator Bill Morrow, yes, and giving the legislative updates. So I don't think there's many people in this room other than maybe John that would remember that. John's been around with us for a while too. So I'm gonna just share a little bit about Aaron and then introduce him, and I'll step out of the way. So Aaron's the Chief External Affairs Officer at Tri-City Medical Center. He joined the medical center at that position in May of 2018. In this role, Aaron is responsible for the healthcare district's marketing, communications, government affairs, and community engagement activities. For more than 2 decades, Aaron has served in positions of progressive leadership in emergency medical services, health policy, healthcare management, and consulting. He has received numerous best practice awards and national recognitions for his leadership and work in healthcare, public health, advocacy, and communications, including 4 Emmy Awards. Aaron was recognized by the Healthcare Communicators of San Diego County with the Communicator of the Year Award in 2017. He's also the founder and chief advocate of Hazel's Army, a community advocacy and education group that in 2014 helped pass the most comprehensive assisted living reform agenda in California's history. He earned his Master of Business Administration in Healthcare Management and Policy from UC Irvine's Marriage School of Business. And Mirage. Okay, thank you.
The founder of the Hot Pocket.
Okay, well, I'm an East Coast guy. Mirage School of Business and a bachelor's degree in social science from Chapman University. Additionally, Aaron earned his certificates of leadership from Cornell University and UCLA's Anderson School of Management. He is board certified in healthcare management as a fellow of the American College of Healthcare Executives. Aaron resides in Vista with his family. So please help me welcome Aaron.
I always jokingly say I'm 95% bridge builder and 5% burn it to the ground. So it's just kind of my personality. But so I started at Tri-City back in May of 2018, and within 2 weeks, we had this little issue of having to suspend operations of our behavioral health unit. And so, you know, we made the rounds, we did a lot of conversations because there was a lot of, let's say, differences in the way people were communicating it. But I'm pleased to be here today to give you an update on where we've come from there and what is hopefully in our very near future at Tri-City Medical Center as it relates to not only a new psychiatric health facility, but also some additional updates that we're making at the hospital. And then depending on how much time, I have a bunch of other stuff that just kind of talks about what we've been doing in the community and other smaller updates at the hospital, just to kind of show you guys, because most people aren't going to the hospital right now unless you absolutely have to. And so I want to give you a little bit of insight into the hospital. Before we start, this is my team. There's some new faces on there. Jessica obviously has been with us, well, 5.5 years now, I guess. Yeah. I just passed 4 years. And then Jillian Dunn at the very end has been with us for about a year. Cassie Clapp, the new marketing and communications manager. She just started about a week and a half ago. Also 4-time Emmy Award-winning journalist. So she's going to be helping us with sort of our communication abilities. And then Kelsey Fetzer starts next week, and she is our new community engagement and events specialist. So we got, I think, a bit of a dream team. Compared to most hospitals, we're about 1/10 the size staff-wise. And so we have to be mighty with what we have. So just quickly, we do, again, marketing, communications, government affairs, and community engagement. So we're managing a whole lot of different projects all at the same time. And recently we've added hospital interiors into it. So you'll see a little bit of that in here. So I'm going to talk a little bit about facility projects. First up is Psychiatric Health Facility. We'll talk about our emergency room remodel, our new MRI suite, which we just approved the bid for. And then our big reveal, I'm going to talk to you about big reveal 1.0 and big reveal 2.0, which includes a little bit of a remodel of our neonatal intensive care unit, including a new Hall of Hope, we call it. So this is the Psychiatric Health Facility. This is a partnership, a 50-50 partnership with the County of San Diego. And thank you to Supervisor Jim Desmond whose birthday is not necessarily Cinco de Mayo, it's Revenge of the 5th, if you're a Star Wars fan. Yes, may the 4th be with you and Revenge of the 5th. So, but we have been working with them for a number of years, Jim Desmond, with our several of our board members, our CEO, and some of our past board members actually ushered in this plan. And the plan is to build a new 16-bed adult inpatient psychiatric health facility on our campus. It would be a standalone unit in the westernmost part of our campus. If you haven't gone up there in a while, if you went up to the ER and you made a left and you went out, it goes out for about 2 or 3 blocks. And there's a new parking lot, which we will tear up to build this. There's a parking lot out there that's sort of on the hill above and behind the Home Depot, just to kind of give you, reference to it. The street that you see down here is Waring Road. So Waring Road going up the hill to some of the doctor's offices and things like that. This facility is somewhat unique. This is part of the larger county and health systems behavioral health reform plan to create more opportunities for people to receive care before a crisis happens. And this is really the important part, because that's not the way that our community or really our country has done it for a long time. And so you may have heard recently about new crisis stabilization units in Oceanside and Vista. And then there's one out in Escondido. This is sort of the next step after the crisis stabilization unit. So once you're stabilized and you needed, let's say, 3 to 5 or 7 days of inpatient psychiatric care, you would go to a facility like this. And the plan is from the County of San Diego to build facilities like these all over the county. So it wouldn't just be in the North Coastal region, but this would be a service and a facility that is primarily for the people of our community. And it is greatly needed. So just a little bit of an overview of it. So like I said, it's a 50-50 partnership. So the County of San Diego is actually building the building, fronting the cost, and then we pay them back 50% of the cost through a variety of in-kind services and things like that. We would actually manage the facility, so the staff would be ours, security would be ours, things like that. Again, they'll provide inpatient care for people from CSUs and also from local emergency rooms. Here's a difference though between this facility and our old behavioral health facility. It used to be that our hospital was what they call LPS designated, Lanterman Petrie Short Act designated facility. I know, sorry. But that would mean that we would stabilize 5150s if law enforcement or fire and police brought them into our hospital. Police and fire will not be bringing unstabilized patients to our ER. They will be taken into crisis stabilization units and other places and then transferred in. So what does that mean? That means you won't necessarily have the revolving door of psychiatric patients coming out of our ER, which was a major concern for people in the community, because most of the people that come in on 5150 don't actually stay. They get stabilized and they move out. That's the role of the crisis stabilization units moving forward. We've been working on this for some time, and we're going to the Planning Commission June 13th. June 13th, Oceanside Planning Commission for this, and we held 2 major town hall forums via Zoom. We only had about 20 people from the community on each of those. We answered lots of questions, had Dr. Luke Bergman from the County of San Diego, Supervisor Desmond was on there, myself, Dr. Mong, our Chief Medical Officer, building folks, and things like that. Answer their questions. We have a website that's up on the county website for the PUF, called a PUF, and we've been answering questions there. And we actually we've only really had one neighbor who had some concerns about construction, and that person has worked in construction for 25 years. And so they were bringing lots of very specific requests, tire washes for vehicles as they leave the construction site and stuff like that. And we have been very accommodating to those. We have received letters of support from the San Diego North EDC, not San Diego EDC, San Diego North EDC, NAMI, National Alliance on Mental Illness, the local NAACP, LGBTQ Center, Solutions for Change, Operation Hope North County, which are impacted by these things, local homeless shelters, all the local chambers, including the Oceanside Chamber, and more. If you are interested in sending us a letter of support, please feel free to do so, because my email is right up there. And the construction is expected to take about 14 months. So from the day that we break ground to the day that we open is supposed to be 14 months, but you know how that is. I have a theory on medical time and earth time. that 1 medical hour is equal to 4 Earth hours. And so you do the math on those things. And so we're hoping to open it as soon as possible. And we really want to get construction started as soon as possible because costs just continue to climb every month that goes by. So we're hoping that it gets to the planning commission and we can get started on breaking ground as soon as possible, hopefully early this summer. Any questions about that before I move on to some of the other projects? Really? Okay, let's do it. We are also working on an emergency room remodel. So, if you've been to our emergency room, you know, it looks a little tired. It's been well used for many, many years, and we're going to remodel it. So the way it works with remodeling an emergency room is you gotta have somewhere to take care of patients, so you do this time, right? So we're doing the first half, hopefully beginning as soon as possible. We're waiting for final approval from the formerly called the Office of Statewide Health Planning and Development, OSHPD, now called HCI. Once everyone learned what OSHPD meant, they changed the acronym. So anyways, what we're going to be doing is we're going to be remodeling the main entrance, the waiting room, the triage area, and what we call Station A, which is one of 4 major treatment areas. So this is generally what it's going to look like. We went with a very coastal feel with everything, and you'll see why here in a little bit when I talk about some of the other projects that we're doing. We're actually kind of theming the ER around the pier here in Oceanside. We're looking at our facility, how it's geographically located, and the westernmost spire out of that facility is the ER. So we figure we'll name it the pier, and I'm playing, because I love my acronyms, playing like a partnership in emergency resuscitation recovery, or Previs Institute for Emergency Resuscitation Recovery, the Previs family. Yeah. Wants to give us more money or something like that. But you can see sort of the difference in the look and really what we're going for with the flooring. And this is not an totally accurate rendition of what the flooring will look like, but we're going sand, shallow water, deep water, and trying to make it feel just more like we're bringing the outside images and colors of our community and our environment into the hospital to create a healing environment. So that project costs about $5 million to do the first half, and the Previs Foundation, Conrad Previs Foundation, the David C. Copley Foundation, and our Tri-City Hospital Foundation have raised that money. So we only have about, I think it's $500,000 more in matching funds that we have to raise to completely cover the first half of it, and we're already working on plans for raising the money for the second half of it. So it really is an amazing project. 85% of our patients come through the emergency room. And so that really is our front door. So this is going to be an amazing project for us. And it's going to fundamentally change the patient experience at our hospital. We're also are putting in a 3T MRI suite at the hospital. So just behind our radiology suite right now, this is the latest advancement in MRI technology. And it's really amazing. I think it's going to be the only one in North County and one of only a few in San Diego County. So it'll give people the ability to participate in diagnostic imaging that is that much more refined and allow our physicians and our clinicians to treat people better, faster. And so that is going in, and that's a big project too. Thank you to the Tri-City Hospital Foundation for funding that, and several major local donors, including one donor who in her will left us, I think, $1.5 million for this project. So really impressive. We also have a lot of other community and facility initiatives. I'm just going to kind of quickly go through some of them. So our philosophy from the beginning of this kind of project, the stuff that we're working on, is bringing the hospital out to the community and the community into the hospital. You know, we represent Carlsbad, Oceanside, and Vista. And for a long time, people didn't even know that that was the case. People in the community, people at our hospital, they don't even know who the Tri are in the Tri-City, right? So we said, we need to really double down on this. And then we also want to do what I call create pockets of awesome. And this really comes from my uncle was a producer for Disney for many, many years. And I was very much, influenced by Imagineering at Disney and kind of creating experiences wherever you go, even if it's in a hospital. And so what we try to do is, if you're walking through an otherwise mundane hospital building, you come across something that is a pocket of something awesome to look at. It's educational, it's visually stunning, it's vibrant, it's colorful, things like that. So with our coastal commitment, which is our outreach initiative that Jessica leads, It's community outreach and support through active leadership. This is financial support to organizations, but also actively leading, serving on boards, doing service projects, things of that nature. We have, actually, this is an old one. We have 87 community partners over the last several years. 87 community partners. So that's during the pandemic. We actually grew the program because the needs in the community grew during the pandemic. So we weren't going to pull back, even though we were financially, it's very challenging to run a hospital during a pandemic. But we've actually upped our financial support in the community. And there's actually more programs than that. It's like 90-something programs now. But really, we're very, very proud of it. Won a lot of awards as a result of it. And here's some of the pictures of us. Just to give you an example, so this is Operation Hope down here. Last year, Operation Hope got a donation of furniture from a large company, but they had no way to pick it up. So Jessica, myself, and our team took our flatbed truck from the hospital. We went and picked up the furniture and delivered it to Operation Hope. That's one of many, many examples. I teach programs on career development for the people in the homeless shelter. Our HR staff comes in and teaches resume writing and interview techniques. Our marketing department rebranded Operation Hope for them for free. So we do a lot of in-kind services, and we do that for 87 different partners. So it's a pretty significant undertaking. SoCal is one of the projects that kind of came out of this in partnership with the Oceanside Chamber, Carlsbad Chamber, Vista Chamber, the school districts, and Setting North EDC. And so we conceptualized it and then built it with the partnership of the Chambers of Commerce. Received a grant for it from Supervisor Jim Desmond to really get it off the ground. We have phases 2 and 3 kind of planned out. Here's the website, and I'm sure we'll look at it again here in a little bit, or at least you had it running in the background. We also created all the collateral for it. So our department designed all the marketing pieces that go out for that. And so we're trying to engage different audiences, students, counselors, teachers, businesses, a variety of different people, parents and grandparents, to get involved with this. And if you're not familiar with SoCal, it's Student Opportunities for Career Awareness and Learning. It's a website where young people or not so young people can explore career options and local educational resources that will help them pursue those career options. Now, I want to take you back a little bit to the big reveal. This is what we called it. We made some big changes for our 60th anniversary last year. So when we were gearing up for the 60th anniversary, we thought, okay, we can't throw an event, really, because we have a pandemic. And that's what our hospital had done in the past. And the hospital looks a little tired. So why don't we approach it and say, hey, what we're going to do for the 60th anniversary is do a little refresh of our hospital, honor our people, bring the beauty of the outside into the hospital. And so that's what we did. And so this is one of the campaigns we did, a Healthcare Heroes poster campaign. So we actually took photos of our people and, we interviewed them. We found out, what were the values that they bring to the table, like compassion, care, healing, things like that. And then we highlighted them all around the hospital. And so phase 1 of that went in, and we had about 45 people that ended up on the wall in different places. One of the pockets of awesome that you would run into. We actually took some inspiration from the things that you guys had done here. We always liked when we came in here, we're like, oh, that looks really nice. We should do something like that at the hospital. We also renamed the towers. So the towers at the hospital used to be called South, Center, and Pavilion. Really interesting. And so we laid them out and we said, well, actually the south one would be Carlsbad, center would be Oceanside, and Pavilion would be Vista. And so we renamed them after Carlsbad, Oceanside, and Vista, just to really drive home the point of who we serve and what is important to us, our community. We also remodeled our elevators. So we created these beautiful images and wrapped our elevators. And so even if you're inside the hospital, whether you're sick and on a gurney being taken somewhere, going to visit someone, or you're just a staff member, you walk in there and it feels like you're outside. And we had these photos taken by Aaron Chang, a very famous local photographer. We'll talk about him a little bit more. We also redid our wayfinding signage. This is an actual picture of our before wayfinding signage. When we did an assessment, we found 12 different sign packages, 12 different looks going back 45 years. And apparently they thought it was okay to just put duct tape on signs at one point. And we said, that's a negative. We're not doing that anymore. And so with the renaming of the towers, it provided us an excuse to redo everything. So on the right of the screen, you'll see some of the new signage. Very bright, very vibrant, easy to follow. Here's another example of what was before and what is now. This is actually downstairs in near the cafeteria. And so because we were downstairs, we decided to put a picture of underwater looking up. So we thought that was kind of interesting. This is Aaron Chang, the photographer, and he helped us with this. And what we did was we installed new art all around the hospital that is aligned with the naming of the towers. So if you're in Carlsbad, you see Carlsbad images, Vista, and so forth. This is at the center of the hospital. We're at this junction point between different hallways. We said, okay, Carlsbad's that way. You're at Oceanside. This is that way. So using visual cues to help with wayfinding. Everyone seems to think that our hospital is really difficult to find its way around, but there's only 3 hallways, right? It's not difficult. It's really, it shouldn't be that difficult. And I worked at UCSD for years, and they have like 15 different hallways. That one's hard. Here's another picture. This is actually that's south of Tamarack Beach in Carlsbad, outside. On clearly a day that I wasn't out, but it's pretty amazing. I would have loved to have been out that day, a little backwash wave. Here's this amazing photo of that we put up leading down towards the emergency room, starting with the theming of it. That's 24 feet long. That's actually the largest piece that metallography this company has ever put together. Here's another one down by the ER of some dolphins surfing waves and things like that. Just pockets of beauty as you're walking down, as I said, an otherwise mundane hallway. This is in the main lobby when you walk in. So it used to be an ad on the inside, and we're like, yeah, not so much, you know, and we don't use that tagline anymore, advanced healthcare for you. And so we put in this amazing image at the main lobby. And so you just can't help but see it when you come in, it just grows as you're walking through. And that picture was actually taken at Tamarack Beach in Carlsbad. And so that goes up about 25 feet. And many of the people think that when they look at it, that it's textured, but it's actually not. It's just such a high resolution image that, that's how it appears. Now, that was the big reveal, so to speak, for the hospital. And we also had like a history wall. We put up a history wall with the decades kind of highlighted of the hospital and our history here, including the founding and the role that the chambers of commerce and the cities played in the founding of the hospital. But here's what we're doing moving forward. There's a long hallway that extends between labor and delivery at our hospital and the neonatal intensive care unit. It is the most boring hallway that I've ever seen. And so what we've decided to do is we're creating a NICU Hall of Hope. And so as moms and parents are traveling from where they're staying in the hospital to see their babies, we are going to line the entire hallway with stories of NICU graduates, positive stories of people that have, young people who have graduated from our NICU, including the picture of them in the NICU and their story. These are the actual images that we're going to use. These are the images that we took. And so those, we're gonna have 17 of them all the way down. We're gonna have music playing in there. We're gonna have inspirational messages from parents and things like that, try to surround them with positivity and create a pocket of awesome. We're doing Healthcare Heroes Posters 2.0. This is one of the first ones. This is one of our therapy dogs at the hospital. His name is Wagner, and so we gave him his own poster. We thought that was pretty cool. I'm sure that'll be the most popular poster of all of them. You've also probably seen our outdoor waiting area at the hospital, which looks like this. Those are lovely taggings there, and an old phone that doesn't have a phone on it anymore. And we have no less than 14 no smoking signs in an area about the size of this. And so we're redoing it. So this is what it's going to look like. We've already ordered all the furniture, everything's approved. So we're going to plant new plants, some beautiful succulents, new seating areas out there, which poses a unique opportunity for our security officers to make sure people don't go sleep on those things. New shade structures to help protect people during the summertime and the wintertime. Very colorful. It's going to be quite nice. And then we're also going to be putting up images of Carlsbad, Oceanside, and Vista on these posts that are out there. We have 3 of them perfectly aligned for Carlsbad, Oceanside, and Vista, so we're going to do that. We're also creating a new mission, vision, and values and leadership wall at the hospital. This will highlight the people who are in charge and our mission, vision, and values. Dimensional lettering, you saw these before, but we're extending it. So we're doing this much dimensional lettering all throughout the hospital. That way, as you're going along, you'll run into, you're like, I know exactly where I'm at. I'm supposed to be here. So using paint and dimensional lettering would be important. We're also doing an all new ADA signage package, which sounds boring to most people, but it's really, really important. And so you will see alignments of the way that these are designed with color coordinated for the city, aqua being Carlsbad, deeper blue being Oceanside and orange being Vista. And that's from our brand. And that's all I got. I mean, these are the things that we're doing right now inside the hospital. Some of the stuff we're doing outside the hospital. This is a fraction, truly, of what we're doing. But we think it's really important. And we think that it sends the right message to our community that, hey, we really value you. We value you in our history. We value you in our present and in our future. So, what questions can I answer for you? Scott.
I'll go first if no one else will. You touched on SoCal, which is the workforce development partnership, and when people think about hospitals, they're not usually thinking workforce development, but that's actually been a huge priority for you guys. So
Yes.
Can you touch on a little bit like what you've done with the pathways at the high school?
Yeah, so, well, like any other business, you're having a hard time recruiting people. But Jessica and I have both worked in workforce development in a meaningful way at our past positions. And we see it in a couple of ways. One, we obviously need good people here at the hospital. We need diverse people here at the hospital. And the best way to get that is to invest in the people that are here in your own community, before they leave and go somewhere else. Give them an opportunity to be educated here, know about the jobs that are here. Most people, particularly if you're socioeconomically disadvantaged, you very rarely leave the four corners of your neighborhood. You don't really know what's out there. We were doing a lot of work, we called it SoCal, where what we would do is we would go out to a school, we would do career day presentations from a variety of different jobs, not just doctor and nurse, because every kind knows about doctor and nurse, but facility managers and environmental services folks and radiology techs and compliance managers and things like that to show people the breadth of the jobs that were out there. We would bring people on tours of the hospital and of our facilities, interactive tours, not like, oh, there's a room closet and there's that, but rather like, hey, how do you get involved? And let's do an EKG and we'll run EKGs on ourselves and things like that. And we were working on a plan to incorporate our work into the curriculum of the CTE programs locally. So if you were working on a project, it would be related to something that was going on at the hospital to get a meaningful experience. The pandemic made that nearly impossible. So SoCal as a website came out of that. It was like, how do we take what we were doing and make it into something that is available to everyone who's at home Zooming on these things? And most importantly, we feel very strongly that workforce initiatives oftentimes fail, or they don't continue, or they're lackluster because of lack of industry involvement, the lack of a major industry player playing a role in there. And so we said, you know what, we should be that industry player. One of the largest, employers in North County, and we've been here for many, many years, and people know us and things like that. So we should invest in this. And we brought it to Scott and to Eric at the San Diego EDC and Brett and and Rachel and all these folks and said, hey, what do you think about this? And they loved it, and Supervisor Desmond loved it, and we kind of blew it up from there. And next up is really integrating what we're doing into the curriculum of the CTEs. We're already working on that. It's making ongoing career day calendars for SoCal, so you can log in throughout the year to watch career day presentations, not just once or twice a year at your school. And then eventually doing shadowing experiences, or what we're calling experientships and internships, working with, I know I've talked to Congressman Levin about it before, about the potential of identifying federal money to subsidize internships for people, because many people from lower socioeconomic status have to work. They don't have the luxury of doing free internships. And so how do we do that? And not just in our industry, in our organization, but throughout the industries. That was a big push for us, is, how do you bring everyone together on this so everyone bought in at the same time? Does that help?
That does, thank you.
Okay, John.
So, I want to phrase this appropriately. So how has the hospital done financially over the last 10 years? And then how do you manage the intersection of philanthropy that comes into the hospital, philanthropy that the hospital does out in the community,
right,
and balance all of that so that you are sustainable?
That's a good question. So financially, we were improving dramatically right up until the moment of the pandemic. And so we were like, posting a positive EBITDA right before the pandemic. Everybody knows what EBITDA is here. Okay, I just want to make sure, you never know. talk at schools, you know, you say EBITDA, they go, huh. So we are posting positive EBITDA. The pandemic has devastated finance for hospitals. They actually just released a report saying that now 52% of hospitals in the state of California are operating in negative margins. And that's a big deal. So we are one of those organizations. You know, the cost of goods and services, supply chain challenges, cost of workforce, all went through the roof. You know, every hospital in the country was suffering under a lack of nurses. You know, nurses left the business or they went to work, you know, travel nurses, and the costs are 3 times higher or more to bring in travel nurses, but you need to have them. The front side of the pandemic, they shut down elective surgeries, which is pretty much everything. So that's revenue not coming into the hospital, and so you have to make up for that. And so we flexed, you know, heavily, and we're able to kind of ride out the first side of this. And I mean, we flexed our staff. I mean, my staff went down to, you know, 50%, most of them. I still had to be there, you know, but yeah, I will tell you that every single member of the executive team voluntarily took a massive pay cut. Our CEO took a 50% pay cut, and then we didn't tell anybody about it. I took 30% because I'm head of household. You know, there's only one income, and that is what it is. So, but you know, you take that kind of cut for over a year, and you do it because you want to keep services open, and you want to keep nurses and everyone else in their jobs. And so we've ridden it out a little bit. We received some help from the federal government. Thank you to Congressman Levin and others for that. We received about $12 million in support. But I mean, to put it into perspective, I think we lost $40 million in revenue in year one. And that's just lost revenue. That's not all the additional costs, which is in the tens of millions of dollars. We've received exactly nothing from the state of California in direct financial support, which is a travesty in my opinion. But you know, it is what it is. And so that's where we're at on that. As it relates to philanthropy, the foundation is an independent organization. It's a 501c3. They raise money that is directly for capital projects. That's all they do it for. There's no intermingling of what they do with what we do. I will tell you that when I came to Tri-City, we spent 3 times as much as what I spend now on community outreach. And it was ineffective. It was completely ineffective because it was just buying tables at events. Like, you want a table? How about we buy 3 that we can't staff, right? And so what we did was we changed it up. We said, what are the needs of our community as identified by the Community Health Needs Assessment the Hospital Association does? Who are the major players who do it the best in our community? We're not reinventing the wheel and doing something that's outside of our mission, but we will support them. And how do we give them financial support and in-kind support? Because that means that we're investing in a really meaningful way in our community. And so that's what we did. So that's how we balanced that. Quite honestly, I've never had a conversation with my boss where he was concerned about what I'm spending on community outreach, because he knows that it has impact in that. I personally believe, I've been doing this for a long time, that what we're doing is going to be the best practice in the country of how to do community outreach. I feel very strongly for that. And we look at what everyone else is doing, and we borrow the best ideas, and we change things that we don't think are going to work. And now, obviously, I'm not spending $500,000. I'm spending $250,000. So I'm mindful of those things. I typically don't give any organization more than $10,000 a year. And I don't promise anything for more than 1 year, because I can't control future budgets. I can control my current budget. And so that's what we try to do, is do things like that. Does that answer the question?
No, that's great. It just, you know, you see Tri-City spending a lot of money. This is fantastic, by the way. I love all the imagery and stuff, but you know, that costs money, obviously.
It doesn't cost as much money as you think it does. Honestly, I spend our money at the hospital the way I would spend my own money, which is frugally. And so if you ask my wife, she might use a different word, but frugally. And so, yeah, it does cost money, but it's an investment. And it's an investment in the look and the feel of our place, and it makes people feel happy. I mean, I can't tell you how many patients and staff members like, oh my God, the place looks so different. I say, just wait. We've only put up 16 photos. We have 120 of them. They're going to be going up with this.
And so a lot of that is funded by the foundation.
No, operations. Foundation doesn't put any money into this. It's all operations. Yeah. Yeah, all operations. It's capital expenses for the hospital, because the foundation doesn't fund the majority of the capital expenses for the hospital. You have to paint, you have to hang up photos. So if you're going to do that, might as well do it with a theme, right? And make sure that it's cohesive. That's what we're doing.
And it's in our experience, what we found quite necessary. Perception is reality, and we were built in 1961, haven't been touched since 1961. It didn't really reflect our services, but it does reflect what people think our services are.
Right.
And so really, it's something that was long overdue. And it's the return on investment will be amazing when it just comes to like what we're able to not only provide to the community, but the community is going to think about Tri-City bring back. You know, I mean, we are the hospital in the area, so we need to be able to keep our doors open and give them good services.
And that is the fundamental challenge. Like I see myself as the chief reputation officer for the hospital, right? And we've had a challenging reputation. That's just the facts, you know. And some of it is because of political upheaval in the past on the board, you know, and some of it is because of turnover in the leadership, and some of it's because of perception of the facilities and things like that. And all that stuff mixed together, you know, those things override positive experiences that people have. You know, if you look at Yelp reviews, you know, somebody with a negative experience is 10 times more likely to make a Yelp review than somebody who had a positive experience. And so, you know, Jessica and I talked about it when I first came on. We said, listen, you know, the most successful businesses out there take the elephant in the room and they bring it down to the front of the room and they say, this is our elephant, right? And the elephant in the room is that we have an old facility. That's one of them. And so we said, okay, our new tagline is proudly serving our community since 1961. And we put that on the front of the hospital on the spire. We took down the blood red spire that was there and put up blue, water and sand. You know, everything else is painted sand on the hospital. So we tried to do things like that and say, yeah, you know what is perceived as our weakness is actually one of our strengths. We've been here for a very, very long time. And just because you see a facility that looks a certain way, doesn't mean we aren't thinking about and investing in that facility. And it also doesn't mean that the quality of care is poor, because actually the quality of care is as good, if not better, than any other place. I mean, our heart care, stroke care, robotic surgery. I mean, we were pioneers in robotic surgery. I mean, we just invested in a new total joint replacement device called the Mako, robotic surgical arm. That information is coming out here pretty soon. We have the Mazor, we have the Da Vinci XI, we have all these things. And our physicians, their error rates are some of the lowest of anywhere. I mean, super, super low. And that's a pretty important thing, you know, when you're doing surgeries. And so we're very proud of what we're doing. We just need to show everybody else what it is that we're doing.
I have a comment, and Supervisor Desmond says this quite often when he took office. That's, you know, he learned what was going on at Tri-City with the psychiatric care, and it was a steep learning curve. But we were talking just the other day in our office, and what that very difficult time in the community and for Tri-City Hospital spurred was a situation now where we just opened another crisis stabilization unit in Oceanside. North County has more dollars being invested into it for behavioral health, crisis stabilization, PUFs, clinicians, boots on the ground going out with our police officers for behavioral health in any other part of San Diego County. So out of that very horrible situation,
Right.
spurred this huge investment into North County. And where that trickles down is city budgets. You know, when they have to have their firefighters, paramedics, police officers transporting down to San Diego, taking 8 hours out of their day that you, the taxpayer, end up paying overtime. It affects the city budget and what they can do with their dollars. It affects you know, our sheriff's budget, which is our overall budget. So it has a huge trickle down effect. And because Tri-City took the elephant in the room, made it a forefront, said, yeah, this is the issue. And there were a lot of complicated issues.
Yes.
And Supervisor Desmond said, how do we solve it?
That's exactly right.
Said, this is how we solve it.
That's exactly right. And, you know, as you guys might remember the very robust discussions we had at that time, you know, when I was going out and doing my kind of roadshow on it. But behavioral health, along with everything else, is extremely complicated. And, you know, we in this county were dealing with the effects of probably 50 years of policy decisions and things that just kind of, I don't want to say matured, but they just kind of developed into what you saw. And if you remember, one of the things that I said after laying the whole thing out was, do you really think that Tri-City is a cause or a casualty of these problems, of these challenges? It's us. This is one piece of a much larger puzzle. And credit to the county and Supervisor Desmond for saying, yeah, you know what? It is a piece of a much larger puzzle. We need to fill those gaps. And so that's what's happened, and we're seeing it. And everyone's going to make mistakes, and then we're going to fix those things. I think as long as you're resolved to actually address those issues, and you guys know I said and talked about in the past. My sister is one of those patients, and it's continually a challenge. And but I see more resources surrounding my sister now than I've ever seen before. We still have significant barriers, particularly on things like conservatorships and stuff like that. But it is definitely getting better. And credit to Jim Desmond, the county, and quite honestly, all the healthcare providers who have been absorbing a lot of the heavy lifting for many, many years for being part of the solution rather than continuing the fight. Anything else? Okay, thank you guys.
Thanks, Aaron.